Continuing with erythrocyte disorders, we've talked about anemia. Let's move on to polycythemia, which in some ways is kind of the opposite. Polycythemia means an excess of red blood cells that increase blood viscosity. Now, of course, that's potentially dangerous because if your blood is too thick, more likely to clot. Of course, that's going to potentially cause big trouble. Results from, so there's polycythemia vera. Vera means true. This is bone marrow cancer. Your bone marrow is not correctly functional. You've got cancer cells. Remember, cancer usually means you're making too many of cells, all right? So you got the tumors of too many. In this case, you get way too many red blood cells, polycythemia vera. There's also secondary polycythemia. So when less oxygen is available, for example, at high altitude, if there's not enough oxygen available, then your body responds by secreting more EPO, and therefore you make more red blood cells, and therefore you got secondary polycythemia. That's not necessarily bad. When you get back to lower altitude, that should correct itself. But there are other disorders in which, for various reasons, you simply make too much EPO all the time, and therefore you get polycythemia. Blood doping, that's what, the Tour de France people, it was originally the marathon runners who did this. So they took EPO or EPO-like drugs in order to give them more red blood cells so they would have more oxygen, because in an endurance event, the more oxygen you have, the less fatigued you'll get. Again, the problem is that you're going to increase your blood viscosity, potentially stroke, and I think there have been incidents in which people doing blood doping did end up dying of stroke because their blood was so thick they formed these spurious clots. So continuing with erythrocyte disorders, even more, hemochromatosis, iron overload or toxicity. So you have too much iron. Remember, anemia was you potentially from not enough iron. Hemochromatosis, too much iron. Usually genetic, but can result from repeated blood transfusions. I don't think that's really common, except for people that have to get almost daily blood transfusions for some reason. Can lead to cirrhosis of the liver, diabetes, heart disease, arthritis, bronzing of the skin. That's a telltale characteristic. Well, that can be other things as well. But highest rate of occurrence in Celtic, English, and Scandinavian peoples, all up there in that part of the world for whatever reason. Again, it's in the gene pool. Kind of like thalassemia was in the Mediterranean. The gene pool up in that part of the world has somehow they're passing on hemochromatosis. Treatment is frequent phlebotomy. That just means bloodletting, all right? So you go to the doctor and they take blood out. You see the lower right cartoon there. Old-fashioned bloodletting, the evil doctor with the bucket, taking a knife, cutting into the guy's arm, using leeches and stuff. So it's treatable, but has to be taken care of. Okay, that was erythrocyte disorders. Let's look at some leukocyte disorders, white blood cells. So leukopenia, anytime you see the suffix penia, that means not enough of, or too low, or something similar. So this is an abnormally low white blood cell count. Radiation will cause this, chemotherapy, immunosuppressant drugs will do this, HIV, the human immunodeficiency virus leading to the acquired immunodeficiency syndrome, flu, chickenpox, mumps, polio, lots of things can produce this temporarily or long-term, either way, acute or chronic. Leukocytosis is the opposite. That's an abnormally high white blood cell count. We saw that again with previously with the erythrocytes. So infectious mononucleosis can cause that, the Epstein-Barr virus. Leukemias. This is what leukemia is. So leukemia is basically cancer of white blood cells. That's what it comes down to. Named according to the abnormal white blood cell clone involved. So either myelogenous leukemia, those are the myeloblasts, lymphocytic leukemia, those are the lymphocytes. Remember the two stem cell lines for the lymphocytes, or for the white blood cells? There you have it. Acute leukemia usually involves blast-type cells and primarily affects children. Chronic leukemia, more prevalent in adults. Leukemia is one of the first cancers that they thought they really could cure, and a lot of leukemias now basically are curable. Not all, but there's at least hope for a lot of leukemias. And there you see somebody with the mumps or mononucleosis, all right? Jill got the mumps, then Jill partied with her friends. Poor Jill. Now all her friends hate her. Yeah, you're at a party. Mumps attacks the salivary glands, so spread through saliva. So, you're at a party, you're sharing a bottle with somebody, or, you're kind of, and then pretty soon everybody gets it, unless you've had your vaccine. So leukemia, let's mention it specifically here, bone marrow occupied by cancerous leukocytes. So at first, this kind of surprises people. Leukemia means you have too many white blood cells. Well, why would that be bad? Well, because they're dysfunctional white blood cells. They're cancerous leukocytes. They're immature and non-functional white blood cells in the bloodstream. Also results in decreased numbers of red blood cells and platelets. So as a result, what happens? These poor people with leukemia, internal hemorrhage, not enough platelets, overwhelming infections. You can't fight off bad guys if you don't have enough white blood cells. So treatments include radiation, transfusions, anti-leukemic drugs, and stem cell transplants. So lots of attempts. Again, a lot of leukemias are essentially curable, but others still are not. So disorders of hemostasis, not homeostasis, don't mix those up like I almost just did. But hemostasis, again, remember, this is basically blood clotting, keeping blood normal. So thromboembolytic disorders are where you make too many clots. Bleeding disorders is where you don't make enough clots, all right? So we're going to take a look at each of those in turn. Just keep them straight. Thromboembolytic, you're making too many clots. Bleeding disorders, you're not clotting enough, okay? And there are some examples right there, pulmonary embolism and so on. You can come back and take a look at that later. So thromboembolytic conditions, thrombus is the name for a clot that develops and persists in an unbroken blood vessel. So thrombus is a clot that forms and then stays put, may block circulation leading to tissue death. Embolus is a thrombus that breaks free and floats in the bloodstream, all right? So pulmonary emboli impair the ability of the blood to obtain oxygen, and cerebral emboli can cause strokes. So that's why this is dangerous. Whenever you form spurious clots, the problem is a chunk may break off and get lodged someplace where you don't want it to get lodged, and then you're in big trouble. A friend of mine, a buddy of mine, a guy I've known since, the 60s, just a couple of years back, he had some atherosclerotic plaques in his common carotid artery, and he went in for what was supposed to be a routine procedure, kind of a roto-rooter to clean it out. And, apparently a chunk of the atherosclerotic plaque broke off, became an embolus, went into his brain, went into his cerebral arteries, and he died of a stroke right there on the operating table. There was nothing they could do. He just had a massive stroke right then and there. So, embolus. In the brain, stroke. In the lung, again, you can't get oxygen now. Either way, it's extremely serious. So continuing with thromboembolytic conditions, how do you prevent them? Well, aspirin. So aspirin is an anticoagulant, all right? People call it a blood thinner. That's really a bad term. It doesn't have any effect on the viscosity of your blood. What it does is it inhibits platelets, all right? It's an antiprostaglandin that inhibits thromboxane A2, which therefore inhibits the formation of the platelet plug and the coagulation to form the clot. Heparin, anticoagulant used clinically for pre- and post-operative cardiac care, a lot of times after surgery. You've been cut open, your body is now going to be healing and clotting, and you want natural healing to take place, but you don't want spurious clots. So they'll put a lot of post-operative patients on heparin to prevent that from happening. Warfarin, known as Coumadin, either the generic, the trade name, used for those prone to atrial fibrillation because blood may pool in the heart. Again, clots may form. So you've seen a lot of the people who are taking warfarin are the ones then that can't clot normally. In other words, there's a price you pay. In order to prevent the spurious clots that might kill you, you're going to allow a few more clots than normal. So have you seen like a lot of old people? They have like these big strawberry marks on their arms and stuff like that. A lot of times those are people who are taking warfarin. They're forming those mean, they're not forming clots. You know, like you bump your arm on something. Normally, you would clot right away and fix that. But because they're taking warfarin, they can't clot right away, and so they end up with those big strawberry patches on their body. And, you know, so-called blood thinners, a term often used for these drugs, technically incorrect. They don't affect viscosity, but I'm not going to fight it. It's in the lingo. Even the doctors call them blood thinners. Just letting you know, you can go ahead and correct your doctor and feel superior. Let your doctor know, you know, actually it doesn't affect viscosity. It's actually truly an anticoagulant. And see if the doctor will ever talk to you again after that. Deep vein thrombosis, so formation of blood clot in a deep vein. Legs are the most commonly affected because of gravity. That's where blood is more likely to pool. Most cases are asymptomatic, but they're potentially serious. Once again, you form a spurious clot, like you see there in the upper illustration, can break off. You get a pulmonary embolism, you get a cerebral embolism, stroke. Risk factors: obesity, pregnancy, smoking, recent surgery, all those more likely to result in blood pooling in veins and forming clots. Sitting for long periods of time. So again, like on the airlines now, on a lot of the transcontinental flights, they have people get up and move around at some point, trying to avoid those deep vein thrombosis. I read a story during the during the Iraqi war. A reporter was embedded with a tank crew, and they're like in really cramped quarters, and he was, basically all, sitting down, hunched over, all, cramped up for a long period of time, and he died. The reporter died of a deep vein thrombosis. He was older, most of the guys in the tank in their 20s. He was like a 50-year-old guy, more likely to have this happen, and he died from a deep vein thrombosis. So edema, tenderness, warmth, redness. Again, if you got this pooling of blood, you would expect edema, tenderness, because it's pushing on pain receptors, warmth because of all the blood that's there, it's going to turn red. More than half, though, show no signs, so it's hard to know ahead of time if this is going to happen or not. And again, you treat it with anticoagulants. That's the easy way to do it. Put people on the so-called blood thinners in order to prevent that from happening. Leukemia is the general descriptor for which of the following disorders: overproduction of abnormal leukocytes, abnormally low white blood cell count, elevated neutrophil count, decreased neutrophil count, or overproduction of abnormal erythrocytes. And yes, leukemia is basically cancer of white blood cells. You're making too many leukocytes, but they're immature, dysfunctional. They don't do their job, subject to infection. So, disseminated intravascular coagulation, DIC. This is widespread clotting that blocks intact blood vessels. What happens is in a generalized area here, you start forming lots of spurious clots in the blood vessels. What that does is it prevents blood from getting to the tissues. Therefore, the tissues aren't getting oxygen. Therefore, you start getting necrosis, and that's potentially very serious. Severe bleeding occurs because the residual blood is unable to clot. So it seems kind of paradoxical. But you start off with an abnormal amount of clotting, and you end up with severe bleeding. What happens is when the abnormal clotting takes place, you use up clotting factors. And then some other place where you need to make a clot, you don't have enough clotting factors, so you get hemorrhaging, severe bleeding at other places. This occurs for a lot of reasons in pregnancy: septicemia, incompatible blood transfusions, trauma, burns. Rattlesnake bite is a good example. You see in the lower left, that's a guy's arm who was bitten by a rattlesnake. Rattlesnake venom has lots of, causes what they call coagulopathies. Rattlesnake venom is very cytotoxic, goes after cells. It's hemorrhagic and necrotic. Rattlesnake venom has toxins that mimic prothrombin activator. So what happens is you start forming a lot of prothrombin. So start forming a lot of prothrombin, then you form thrombin, then you start turning fibrinogen into fibrin, and you start making clots. So that's why rattlesnake bites, and the bites of all the viper family for the most part, they cause this abnormal clotting behavior. They cause DIC, and that's what you're seeing in that illustration on the lower left. That guy has edema and hemorrhaging in his arm, and that's because he's got DIC. It starts with too much clotting. Some of the black there may actually be tissue death, and the too much clotting eventually leads to hemorrhaging, leads to abnormal bleeding. This is potentially life-threatening, all right? So there's the rattlesnake. Aren't they gorgeous? I think they're just such magnificent creatures. I took that picture. I was about 10 inches away. I found that rattlesnake in a wash, and it was sleeping. So I got down on my stomach with my camera, and I just started inching forward, and I got to where I was only about 10 inches away, and I was able to take that picture. Then suddenly it woke up, started flicking its tongue, so I immediately backed up. There's another rattlesnake. Gorgeous creatures, aren't they? They really are.